When children need liver transplants, they typically only need a donor to give them a small part of the liver as a living donation. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker introduces us to one courageous child who needed a full liver transplant not once, but twice in his few short years of life.
This is 3-year-old Alan Herrera. His mother Joanna and father Israel say he was a healthy baby boy for his first 8 months.
2 weeks after he turned 8 months, it just started to go downhill from there.
Alan's health suddenly took a turn for the worse. They found out he needed a liver transplant.
It was scary. We've never gone through this. We didn't even know people that had gone through it.
There is whole life ahead of him that would be not possible if a timely liver organ is not available.
Dr. Naveen Mittal, the director of the Pediatric Liver Transplant Program at University Health System, says there is always a need for more donors, both living and deceased.
We do need a good community support in terms of organ donation and also awareness of the community that we have a strong program.
God heard our prayers and he got his transplant.
But little Alan's problems were not over.
From his arteries collapsing so much, his liver wasn't receiving enough blood. So that's why it started to go into rejection again.
So Alan is back on the transplant list.
My husband is the same blood type as Alan, but they said that his liver has to come from a deceased donor. His liver has to be a full liver.
And even though they are needing help from others, Alan's parents are paying it forward too.
We actually donated blood yesterday.
If only everyone was so generous, little ones like Alan may not have to wait as long for a life-saving organ.
I'm trying to find you.
Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just head to wearthegown.com.